Hello, everyone, and thanks for joining us today. My name is Jason Lotzer, and I'd like to welcome you on behalf of Blue Cross Blue Shield of North Dakota to the COVID-19 coverage webinar, an update for providers. We're taking measures to keep members covered, keep your employees healthy, go deeper in our relationship with providers as partners, and we're doing everything we can to ease the administrative burden for you. That being said, things are moving so fast. These are unprecedented times, and we're monitoring the situation following CDC, state, and federal guidelines and recommendations. We're collaborating with the North Dakota Department of Health, the North Dakota Insurance Department, and other state officials and leaders. Like you, we're all implementing change and policy in real time, so it's fluid, and the topics we're about to discuss reflect what's in place today, which may change as the situation changes. For the agenda today, we'll be discussing locating COVID-19 information, expanded coverage for members, billing and coding guidelines, expanded telehealth services, and also get you some resources for ongoing updates. A few housekeeping items before we get started. Everybody will be on mute during this webinar, but you'll be able to ask questions at any time. So if you look at the GoToWebinar panel, you'll see a tab where you can type your questions and then at the end of the presentation, we'll answer as many as possible. So we encourage you to do that as we're going through this. Just go ahead and type those to get a few going. The information we'll share today is correct as of May 5th, 2020. This is not a warranty or promise of coverage or legal advice. The CPT codes descriptors are copyright the American Medical Association. For the most updated information, we've created a special website to address COVID-19 topics specifically related to providers, including expanded coverage for members, billing and coding guidelines, and then some frequently asked questions. To get there, just visit bcbsnd.com/COVID-19 for more information. From there, you can click on the COVID-19 link for providers. It's right on the top there. And then that will be the information that pertains to all of you joining us today specifically. So I'd like to introduce my fellow presenters today. Kiana Piowski is a provider education specialist. Kimberly Behrens is a provider education specialist as well. And Chelsea Matter is the director of provider engagement. Thanks again for joining us today and your continued trust. And you can take it from here, Chelsea.
Thank you, Jason. In response to the COVID-19 pandemic and the resulting economic impact for so many of our members, BCBSND is trying to help by expanding coverage and waiving members' out-of-pocket expenses. Throughout the next couple of slides, we will cover the ways in which BCBSND has expanded coverage for members during the COVID-19 pandemic. Effective March 1st, 2020 through May 31st, BCBSND will waive any cost sharing, which includes copays, deductibles, and coinsurance for medically indicated testing of COVID-19, so that cost sharing does not serve as a barrier to access these important tests. Cost sharing is waived across all BCBSND plans, whether fully insured or self-funded. With the expansion of COVID-19 testing technology, currently, there is no coverage for asymptomatic individuals when used solely for public health screening purposes. COVID-19 antibody or serological testing will be covered at 100% only when medically indicated. For those diagnosed with COVID-19, medically indicated treatment is also covered without cost sharing. However, that only applies to our fully insured lines of business. For all other plans, treatment costs are subject to the member's regular benefits. In order to reduce any barriers for members who suspect they have COVID-19 from receiving care, BCBSND has also waived any cost sharing associated with an office visit, whether that's through the clinic or the emergency room. In addition, any medically relevant testing a member may receive during their visit, such as influenza testing or chest x-rays, are also covered, provided the visit results in a COVID-19 test being ordered. In addition to professional services, and as mentioned previously, BCBSND will waive out-of-pocket costs for the treatment of COVID-19. This includes hospital stays and outpatient treatment. As a reminder, this only applies to BCBSND members on fully insured plans. All other plans are subject to the member's regular benefits. Please also note all services will be paid at an in-network rate. BCBSND has also increased access to prescriptions by allowing pharmacies to refill prescriptions earlier than typically allowed. In addition, most plans allow members to fill maintenance medications for up to 90-day supply through a local or mail order pharmacy. When it comes to supplies, we are also allowing requests for additional supplies outside the normal quantity and frequency limits during the COVID-19 pandemic. Now I'm going to turn it over to Kiana to walk through some billing and coding guidelines.
Thank you, Chelsea, and again, thank you to everyone for attending today's webinar. My name is Kiana Piaski. I'm one of the provider education specialists here at Blue Cross, and I'm going to be covering coding and billing guidelines as they relate to COVID-19 services. Our teams here at Blue Cross have tried to keep up with the changes that have occurred daily and sometimes even hourly during the past several weeks with relation to COVID-19. In response, we have sent out several healthcare news updates to keep the provider community aware of the changes made to billing and coding guidelines as they follow state and federal guidelines. We also want to mention that our COVID-19 webpage is going to have the most up-to-date information as it relates to coverage changes, billing and coding guidelines, and even frequently asked questions. Some of these changes with regards to billing and coding include new modifiers, CPT and HCPC codes, and diagnosis codes. The next several slides that I'll be going through are going to help answer some of the billing questions you have, including how to bill professional services, lab services, and outpatient and inpatient facility services. With regards to coding and billing guidelines, the first thing I would like to cover is the modifier. We have received a lot of questions regarding which modifier do I use to identify COVID-19 related services. We took a look at what Medicare requires as well as the requirements of other payers, and we have actually opted to accept 3 modifiers to identify COVID-19 related services. These modifiers are 32 for mandated services, CR, identifying catastrophe disaster related services, or the CS, services related to cost sharing waivers for COVID-19. By accepting all 3, we're hoping it makes things a little bit easier for our provider community when they're billing their claims. Only one of the 3 is required on a claim, and appending one of these modifications will help us identify appropriate cost sharing waiver amounts regardless of the modifier you use. Appending one of the COVID modifiers, 32, CR, or CS, helps us identify cost-sharing amounts that should be waived. For claim submission, we ask that the following guidelines be utilized. If all COVID-19 services rendered on the same day are going to be billed on the same claim, a COVID modifier only needs to be placed on the office visit and the test or collection line. If services rendered the same day as a COVID-19 test are going to be billed on different claims, such as you're billing an office visit on a 1500 form and an x-ray on a UB04, we ask that a COVID-related modifier be placed on each line of service to ensure correct processing of claims. This ensures that the related claims not billed with the test are processed to waive cost shares appropriately as well. Our next slide, COVID-19 related professional office visit services, outlines the 4 parts of a billed line of service. We have our CPT and HCPC codes, diagnosis codes, place of service codes, and our COVID-19 modifier, which is perhaps the most important as we work through this pandemic. This modifier is what's going to help us process this claim to waive applicable cost shares in relation to that COVID-19 test. Our next slide talks about COVID-19 related lab services. If you're ordering the COVID-19 test and it's being performed at your facility, you would go ahead and bill the appropriate CPT or HCPC code, append the appropriate diagnosis and place of service code. You would also want to make sure to include a COVID-19 modifier, such as the 32, CR, or CS, along with any other appropriate modifiers. If the test is being sent to the state lab, you would not bill the test to North Dakota Blue Cross. You would simply append a COVID-19 modifier of 32, CR, or CS to the office visit and collection fee. Please note, the collection is an inherent component of an in-person E&M visit, so it should not be billed unless it's the only service provided that day. When billing on a UB04, whether for inpatient or outpatient claims related to COVID-19, these are the following guidelines we would encourage you to follow. Again, you'll have your COVID-related diagnosis codes, and on outpatient claims, your COVID-19 related modifiers, 32 CR or CS. In addition, on UB04 claims, we would also like you to use the condition code DR, disaster related, to help further identify claims that are COVID related. Our final slide related to COVID-19 billing and coding guidelines revolves around billing for DME and HME services and supplies. In order to ensure that our members have access to their supplies during the pandemic, we are allowing additional supplies outside of the normal quantity and frequency limits to ensure members have uninterrupted supply. In order to ensure that those claims are processed appropriately, we ask that you would append a COVID modifier, 32 CR or CS, to claims that meet the following conditions. Either their DME, HME supplies and services furnished to members outside of the normal quantity and frequency limits, or the DME or HME service or supply is directly related to COVID-19. Now I'm going to turn it over to Kimberly, who's going to talk about expanded telehealth coverage.
Thank you, Kiana. My name is Kimberly Behrens, and I'm part of the provider education team here at Blue Cross Blue Shield of North Dakota. The safety and security of our members and all of North Dakotans at this time still remains our top priority during these unpredicted times. Blue Cross Blue Shield of North Dakota remains committed to making sure that members can connect with their providers. During these times, we are aware that some providers like you may have not provided telehealth services prior to COVID-19. So at this time, we'd like to go ahead and take some time to determine the new process. We also want to make sure that we are able to help secure the goal of Blue Cross Blue Shield with the expanded coverage for telehealth services for all of Blue Cross Blue Shield members. Blue Cross Blue Shield is allowing for a patient to reside in their home for a telehealth service, which in some cases will include those video calls, those phone calls, emails, online chats, which also include FaceTime and Skype calls. As most providers are aware, we're going to cover the expanded telehealth services for the following items. For providers who provided telehealth services prior to COVID-19, there is no change, and more than likely this is not new to you. First of all, let's go ahead and take a look at the telehealth visit. If you're not familiar with this is a visit with a provider using a telecommunication system connecting the patient with the provider. Next, we have the virtual check-in, and that is considered the brief communication through a telephone or other telecommunication device to decide whether an office visit or other service is needed. This is where a remote evaluation of recorded video and/or images are submitted by an established patient. And the third is the digital telecommunication, also known as the e-visit. This is where the digital communication is initiated by the member to the provider through the provider's online patient portal. Now we're going to take a look at the telehealth billing requirements. First of all, it is important that the provider appends the following code modification and the place of service, which helps Blue Cross Blue Shield of North Dakota identify that appropriate cost share waiver amounts for the telehealth service. The first item is the modifier 95, and the second most important piece of information is your place of service, which in this case needs to be 02. It is important to recall that Blue Cross Blue Shield is allowing for a patient to reside in their home for telehealth services. Now let's take a look at the telehealth reimbursement. Many telehealth services indicated by place of service 02 prior to COVID-19 had a site of service differential. Blue Cross Blue Shield of North Dakota will reimburse providers based on those rates. Blue Cross Blue Shield of North Dakota will allow for that patient to reside in their home for that telehealth service, but keep in mind that home does not qualify for the originating site location. The coding guidelines for Q3014 have not changed during the pandemic and can only be billed if the patient is going to an originating site. Those originating sites are authorized by law, and they include the office of a physician or practitioner, your hospital, your critical access hospital or CAH, the rural health clinics or RHCs, federally qualified health centers or FQHCs, hospital-based or CAH-based renal dialysis centers, your skilled nursing facilities or SNFs, and your community mental health centers. These are just to name a few. The information listed on this slide is related to the COVID-19 telehealth service. Once again, that telehealth service is a visit with a provider using the telecommunication system connecting that patient to the provider. In order to bill the service appropriately, you are required to bill the appropriate CPT or HCPC code for the telehealth service rendered. Those codes are listed here for E&M services and inpatient services also. Next, you are required to bill the appropriate COVID-19 diagnosis. Then you will append the place of service 02, which indicates it is telehealth related. You will also be required to append one of the COVID-19 modifiers, so that would be your 32, your CR, or your CS. Once again, remember, you're only required to append one. And last but not least, you are required to append the modifier 95, which indicates to us that it is a telehealth related service. Also, if there are any additional modifiers, please go ahead and apply them if applicable. Now we'll go ahead and take a look at a COVID-19 related virtual check-in service. Once again, that virtual check-in service is when you are providing that brief communication through a telephone or other telecommunication device to decide whether or not an office visit or service is needed. Keep in mind that a remote evaluation of recorded video and/or images submitted by an established patient. In order to bill these services appropriately, you are required to bill the appropriate telehealth virtual check-in CPT code or HCPC code as identified on the slide. Next, you will append the appropriate diagnosis code related to COVID-19. Next, indicate the place of service 02, which once again represents the telehealth service. And last, you will be required to append the appropriate modifiers. First of all, you are required to append one of the COVID-19 modifiers, which include your 32, CR, or CS. Next, append that modifier 95, which once again represents that is that telehealth related service. And last but not least, if you have any additional modifiers, go ahead and append them if applicable. Last but not least, now we're going to go ahead and take a look at the COVID-19 related telehealth digital visits. The digital visit, also known as an e-visit, is the digital communication initiated by a member to the provider through the provider's online patient portal. In order to bill the digital visit, bill the appropriate telehealth digital visit CPT or HCPC code as identified on the slide. Next, you will go ahead and append the appropriate COVID-19 diagnosis. You will append place of service 02, and last, go ahead and append those appropriate modifiers. In order to append the appropriate modifiers, you are required to add one COVID-19 modifier, which those are your 32, that CR or CS. You are also required to add modifier 95, which once again represents it's a telehealth service. And last but not least, go ahead and add any additional appropriate modifier if it's applicable. Now I'm going to spend a few minutes talking about the non-COVID-19 related expanded telehealth services. To allow for social distancing, Blue Cross Blue Shield of North Dakota has expanded their telehealth coverage according to the state guidelines. As far as telehealth services may be billed if the provider can meet all of the criteria of the CPT or HCPC code rendered. which in some cases may include but are not limited to services which include an office visit, your PT, OT, or speech therapies, your behavioral health and substance use disorder treatment and/or therapies, including group therapies. We also have the Applied Behavioral Analysis, or ABA, the diabetic education, and the nutrition counseling. Those are just to name a few. We also do want to make sure that you are aware that as far as deferrable elective care is not included in the expanded coverage per the Governor's Executive Order 2020-05.1. Also keep in mind that expanded coverage does not apply to elective care, which includes chiropractic care, dental care, and acupuncture. As you can see listed here are those non-COVID-19 related telehealth services. So we've listed examples of your telehealth E&M, the telehealth inpatient, the virtual check-in, and the digital visit. Now these are services that are not related to the COVID-19. You are allowed to bill telehealth services on a CMS 1500 claim form unless specifically noted on the table on the upcoming page, which in these cases, those services are billed on the UB04 claim form. Telehealth services, as far as the billing requirements, once again, you are required to bill the appropriate CPT or HCPC code for the telehealth service rendered. Next, you'll go ahead and apply the applicable diagnostic code. You'll add modifier 95 and any additional modifier if they are applicable. And last but not least, you'll identify that place of service 02. The information provided on this slide is a result of the Telehealth UB04 information. As you can see, the services indicated on this slide are in relationship to the Telehealth Intensive Outpatient Program, the Telehealth Partial Hospitalization Program, and the Telehealth Hospital-Based Therapy. In order to bill appropriate, we ask that you utilize your type of bill, revenue code, CPT, and HCPC code as if the patient was located in the office. Next, we will ask that you append the condition code of DR along with appending modifier 95, which once again represents that this is a telehealth related service, and any additional modifier if applicable. We also want to make sure that you are aware that for telehealth IOPs and PHPs may be billed if the information meets all of the required of the traditional IOP and PHP and will be reimbursed at a per diem basis. If the services rendered do not meet those requirements of the traditional IOP and PHP, it will be reimbursed based on the billable service, which is payable and credentialed by providers such as an LPCC, an LAC, an LCSW, a PhD, etc. And in return must be billed on the CMS 1500 with the place of service 02 and a pending modifier 95. If you are watching the presentation live, we will go ahead and send out a link with more information and resources about COVID-19, which will be sent to you following today's webinar. Before we conclude today's webinar, we do want to share 2 additional resource slides with you. The first resource slide we'd like to provide is information in regards to cost share waiver questions. If you have questions in regards to whether the cost share waiver was applied appropriately, please verify eligibility for your member through Availity. Availity allows you to verify the member's product type, indicating whether they are fully insured or if they reside under an individual plan. If you do have additional questions, we strongly encourage you to reach out to Availity at 1-800-282-4548. The hours of operation and the days of the week are listed here on the slide. Also, we do encourage you, if you have additional questions, to please reach out to Blue Cross Blue Shield of North Dakota Provider Services. They can be reached at 1-800-368-2312 and our hours of operation are Monday through Friday from 8 a.m. to 4:30 p.m. If you have additional questions that were not addressed in today's presentation, I encourage you to visit our website under COVID-19, where we have a section of provider frequently asked questions in relationship to the COVID-19 pandemic. As you can see, the link is attached here on the slide. If you do have additional questions, we strongly encourage you to reach out to our Provider Contact Center at 1-800-368-2312. Also, your questions can also be addressed or answered by the Provider Engagement Team at prob.partners@bcbsnd.com.